Again, yes. Unfortunately, we have to announce 4 additional deaths due to COVID-19 today. 3 residents at Northwood in Halifax, as well as a resident in Harbourstone long-term care facility in Sydney who has also passed away. Like the Premier, I'd like to offer my sympathies and condolences to each of these families as you struggle with this loss. We now have 16 Nova Scotians in total who have died as a result of COVID-19. Today, I'm also announcing 55 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 827. We currently have 10 individuals in hospital, 4 of those in the ICU. We have 358 people now who are considered to be recovered from their COVID-19 infection, and 23,731 Nova Scotians have been tested and their results have been negative. Again, a testament to our broad testing strategy and our capacity at our labs. We have 10 licensed long-term care homes and unlicensed seniors facilities that have cases of COVID-19, and in total that involves 158 residents and 79 staff. As I said yesterday, Nova Scotia, we have now conducted more COVID-19 tests per capita than any other province. The Kiwi2 lab processed 921 tests yesterday. And while we know that 2/3 of these tests came from within the Nova Scotia Health Authority Central Zone, which is the Halifax and West Hants, about 100 tests also came from each of the 3 other Nova Scotia Health Authority zones. This shows the need for ongoing testing across the province. We still have a lot of people whose symptoms could be COVID-19. We have been aggressive in our testing to identify cases as quickly as possible and then to track those cases and isolate the case and quarantine all of their tight contacts. The testing and the public health follow-up, along with the strict public health measures, has been key to only having limited community spread in most parts of the province, and that needs to continue. We are proud of the testing capacity that we have, and we need anybody in Nova Scotia who develops 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose, to either go, if you're able to, do the online 811 assessment, and if you're unable to do that, calling 811, and then we'll get you, if appropriate, give you further advice on how you can be tested. It's important that we continue to have anybody who might have COVID symptoms come forward promptly and get tested. I know that as the days go on and the weather gets nicer, that the restrictions that we're all under begin to weigh on us more and more. Everyone in public health, whether it's here in Nova Scotia, across Canada, or even internationally, we're thinking about how restrictions can be lifted. And that discussion is very active here with myself and my colleagues in public health here in Nova Scotia. But Nova Scotians do need to understand that this process will necessarily be slow and deliberate, that we need to find the balance between starting to open restrictions, allowing people more freedoms, allowing the economy to begin working again, but also ensuring that we don't do that too much or too quickly, and allowing COVID-19 to get a more aggressive foothold in our province. What we consider normal before COVID-19 is still a long way from returning. Certainly here in Nova Scotia, it'll be several more weeks before we can even begin to start easing any of the restrictions. And when we do, this will be a phased approach. I know that people have lots of questions. I know that you're watching what other jurisdictions are saying and doing, and some jurisdictions in Canada were talking about starting in May, even earlier today in the news. But that each jurisdiction is somewhat different, and we have to base things what's happening here in Nova Scotia, both in our what our epidemiology tells us and what is necessary and appropriate to do here in Nova Scotia. I know lots of people are just anxious to know what life will look like a month from now, 3 months from now. We are working with a plan that certainly will be start to bring that plan to the Premier and his staff for their consideration next week. But it's a plan that we have to all be comfortable with, ultimately the Premier and I. And when we are comfortable with that plan, we will share it with Nova Scotians so we can bring in to all work together to move that plan forward and all be on the same goal. And that goal will remain, our top goal will remain, protecting our most vulnerable citizens from COVID-19, along with protecting our healthcare workers and our healthcare system. It's important also that people understand that even though a lot of the COVID-19, the numbers we present every day and the disease activity we focus on is here in HRM, but there are COVID-19 cases that we're reporting today from other parts of the province. We still have COVID-19 activity and the potential for the spread of COVID-19 across this whole province. Just the fact that we are today, one of the deaths we're announcing, unfortunately, is from Cape Breton, illustrates that fact. We're a small province geographically, and COVID-19 moves as people move. And if we give it a chance, it will move across the province. So for now, we need to maintain our vigilance. It's not just for our own health, but it's for the health of your elderly neighbor, for the health of your sister or brother who is a healthcare worker, for your friend who is a cashier in the grocery store, or for your father or mother who has COPD or congestive heart failure, some other serious chronic condition. Staying home, maintaining social distancing, and following public health directives ultimately is about saving lives. It's about caring for one another by putting someone else's health first. It's about building community that supports all of us to do these things and do them well. And it's about using common sense to make sure that you stick with the strong public health measures rather than looking for loopholes.